Hello and welcome to another edition of Health Matters. Because your health matters to us, we are committed to bringing you quality programming about a variety of issues so that you can have the power to make great choices for your health. My name is Anna Marie Sinatra, and as you know, my business is Sinatra Solutions. I am a coach, a consultant, a trainer, a motivational speaker, and I love partnering with you to help to catapult you in whatever it is you're up to in life. Whether you want to grow your business, whether you want to grow yourself professionally, whether you want to do some inner office training, sales training, I work with you in a variety of ways to help bring you power to help to catapult you to that next level. I am really excited today. This program is such a blessing to you. I appreciate all of your emails, all of your phone calls, and I truly appreciate all of our sponsors. We know that Western New York MRI is committed to making sure that this program is on the air every week so that you are getting information about a variety of topics to help to create better lifestyle and better health for yourself. And we know that Western New York MRI has the state-of-the-art diagnostic machinery to help to test to find out any issues that are going on with you immediately. We know because we've been there so many times and you've seen all the great work that they're doing. And I also want to thank Linda from Renaissance Hair Salon, where she uses all natural products to bring out your natural beauty. She does my hair and my makeup, and I'm always very grateful to her because you know I'm always talking about how important it is to be aware of the products that we're putting on our body as well as what we're putting into our body. It all matters, folks, and you know because you're watching this program, you're getting good information, and you're making those changes in your lifestyle to give you power to have great health. I'm so excited today because we are at the Main Wellness Center on Main Street in Buffalo, New York. And in just a minute, we're going to hear from Dr. William Holley, who's a podiatrist, a foot specialist, a board-certified foot surgeon. And I know that you're getting your pens and pencils ready because the information that you're about to get is about to change your life. So stay tuned, watch, and take lots of notes. I am now sitting in Dr. William Holley's office. This is so exciting. Dr. William Holley is a podiatrist, a foot specialist, and a board-certified foot surgeon. When I was out in the waiting room, I was able to read a lot of the pamphlets and learn so much. So again, make sure that you have your pens and paper ready because you're going to get some really great information today to help you with proper foot care. Welcome, Dr. Holley.
Well, it's enjoyable to be here with you today.
Thank you. Thank you. It's really great for you to sponsor this program today and be committed to giving the community so much needed information.
Yes, I'm enjoying the opportunity to share with the community. I've been in practice now for 17 years, but it's good to be a part of your show.
Oh, thank you. Thank you. So you've been in practice for 17 years. Has it always been in this area?
Yeah, I've been in the Buffalo area, but I started on Humboldt Parkway with Dr. Kenneth Gales and his the Gales Medical Center. Give him a little plug there. I started off with him, and then now I have my own practice, and I operate out of the Main Wellness Center now.
Yes, and I understand as I was reading your brochures and we were talking earlier that there's so much for us to cover, and I want to know more about your background as well. But when you say the Main Wellness Center, I also wanted to point out that you have like a full, complete service here for their feet. Whether it's just a checkup or I was reading a lot about the nail fungus, all the different problems that come with feet that might even lead into some surgery.
Yes, I'm able to work on anything related to the foot or the ankle, basically medical or if there's any surgical intervention that needs to be taken care of, I do that as well.
And so you do just minor surgery in the office here, or what kind of surgeries would you have in the office?
In the office, we're not as invasive. If it really requires me to open a foot up completely to see different to address whatever problem there may be, then I'd have to take them to the surgical center. That's what we do in that instance.
So tell me a little bit about, let's back up just a little bit, and tell me a little bit about what made you decide to go into podiatry.
Well, I had always, from a child, I always wanted to be a physician. But as far as the specific field of podiatry, I was introduced to it by my college professor at Canisius College. He basically introduced me to the profession, and as I looked into it further, I thought it would be an area of medicine that I would like, and once I did find out more about it, I liked it, and therefore I went into it.
And do you just treat adults, or do you treat children as well?
Oh, we treat adults and children, so basically anyone that has a foot, we can take care of.
And I love your little logo, too. His little logo says, keeping you on your toes.
Yeah, well, that was something I thought of earlier on when before I began practicing. I thought that would be a good logo to have. So
It really is. It's very catchy. It's very cute.
Yeah. Well, everyone seemed to like it, and then we also had the big red foot in the window, so if you're going down Main Street, you can't miss us. If you see probably the only podiatrist probably with a foot in the window, but we have that on Main, so if you're down Main and you see the big red foot, that's me.
That's you. And do you take different types of insurance?
Oh yes, we right now we're accepting most insurances, and the ones that we don't have, we are working on that.
And also, I know that when people have, is it Medicare, that you have a full line. I believed in the beginning of the show they saw the your waiting area with all the shoes and the sneakers and the different things you can get for your feet for good foot care.
Well, yes, certainly with the aspect of diabetes, is the Medicare insurance is very interested in with the elderly and making sure they have appropriate shoe gear. So we make sure that we have a full range, whether it's sneakers or walking shoes or dress shoes, for them to select from. So to make sure that they have the best shoe gear to address whatever they're engaging in, they have the best shoe gear possible.
And so some insurances will pay for those, and then others, the patients have to pay for those on their own?
Well, Medicare is primarily the insurance that does address that, but depending on your plan, there are other insurances that may cover, but Medicare primarily is the one that may set the benchmark for that to make sure that they are addressing all of the needs, especially with diabetic patients.
Oh, that's pretty awesome. So for our viewers who are watching today, let's talk a little bit about some of the problems that come with feet. I know, again, when I was reading your brochure, this is an awesome little brochure that explains a lot. You talk about bunions and calluses and heel spurs and hammer toe and ingrown toenails, and also diabetic ulcers. So wherever you want to start, because I know sometimes, especially being summertime, we're out there in the park seeing everybody out in their sandals, and I know I try to take real good care of my shoes. We won't go about the high heels yet. Yes, I know. I think I wore the wrong shoes when I came today. So we're not going to show you my shoes. They're a little high. But, yeah, especially us ladies, we're really, wanting to take care of our feet. And sometimes it poses a problem. I know from my own experience. So, yeah, how could we take care of our feet in a way for preventative medicine?
Well, I really try to encourage everyone to come to the podiatrist. I think the area of medicine that persons are more readily to go to are like into dentistry. I mean, pretty much everyone is going to get their teeth cleaned or something at some point. But podiatry, still people are a little reluctant to go. Like, well, my feet are okay, and they just don't come in. But I really try to encourage everyone because a lot of times you don't know, especially if you are diabetic. For sure, you have to come in, or if you have any abnormalities in the way of your feet swell a lot. Or you mentioned ingrown nails. A lot of times people think that they can just go and perform their little bathroom surgery, and I try to encourage people not to do that because more often than not, they get their little clippers out and start digging around on their toenail, and they end up coming in anyway. So why not just come in at the beginning? So
what is an ingrown toenail actually? Is that be like when we cut them, if we cut too short and there's a tip on the edge? I think I was reading about that.
Well, with the ingrown nail, basically it's just as it says that the nail is growing in. So basically it curves underneath the flesh so that it's hard to get along the edge of the nail. And then if you end up injuring your foot, maybe you dropped a book on it or you bumped your toe, then that can cause a lot of pain. Or either shoes may be a little tight. And so there's a number of instances where it can become more problematic. So in order to identify whether you really have an ingrown nail or not, it would be need to come into the podiatrist. So because a lot of people you don't know, you're not skilled in that area, so it'd be good to come in so we can tell you what you need to do if you're dealing with ingrown nails. If you're having pain along the edge of your nail, then that more than likely you do have an ingrown nail.
And better not to do bathroom surgery. I like that. That's cute. Trying to take care of our own self. And what about calluses? Like, what does a doctor, a podiatrist suggest? Because we see so many commercials on TV, trying to get us to buy all these different products, whether we're shaving off the calluses, lotioning up. I mean, what really works?
Well, I found that the best way to address it is just to come in and really to get evaluated. Because a lot of the products that are on the market may be harmful to you, especially if you're diabetic, or if you're having any circulatory problems, So basically, it's a good thing to come in. The pads that you should use some pads in certain instances, but the best pad for you would be up to your podiatrist, like myself. Come in and then I could tell you what would be the best thing, because a lot of those pads may have acid on there, which would actually helps to decrease the thickness of the callus or corn, but then also can start eating away at your normal skin, and you don't want that.
No, not at all. And what about, what is a hammer toe?
Well, hammer toe is just when you have a contracture of the toe, where if your toes are not perfectly straight but they bend in, then that would indicate that you do have a hammer toe. And I guess I always joke about this, but when Eddie Murphy had the movie Boomerang, yes, where I got a lot of patience behind that, because a lot of people knew, oh, that's a hammer toe. I never knew what that was, So so I got a lot of patience behind it.
It's funny that you mentioned that show, because actually I was thinking about that when we were talking, how Eddie Murphy was always looking at the feet to make sure and we know, ladies, we're taking care of our hair and our makeup and our nails. We want to make sure that our feet look good too.
Yeah, and really that is I guess it would be the biggest population in our females. Men are a little more shy about coming in, but the ladies, if they got a problem, they're right here,
Well, let me tell you, man, we care about how your feet look too. So you all need to just come on in and visit Dr. Holley, because we do care. We're looking at you out in the parks with those sandals on.
Well, that's usually how it happens, though. I mean, the ladies say, like, and like the guys will come in and they'll say, well, the only reason I'm here is because my wife made me come in. Otherwise, I probably wouldn't be here. So, but then after they come in and they get to know me and understand that, they're a little less reluctant to come in, I guess. Men are like, oh, I'm okay, but once they come in, they find that it's okay.
Yeah, that's neat. And so funguses can always be a problem, and a lot of people don't know that they have fungus. We were talking a little bit about the color of the nail is a good indicator.
Well, yes, if it's discolored or thick or brittle or dry looking, those are indications for you to come in to really get that addressed, and don't just pass it off. And a lot of times, too, ladies will go to the pedicurist to get things. Now, there's nothing wrong with getting your nails done and all like that. I mean, because you want to look cuter with something. But still, you should come in and just to find out, what's going to be the best. Because some of the people out there don't really clean their instruments that well. So
yucky.
You cause a lot more problems that way. So it's better to come in and let me look at it first, and then let you know, okay, it's okay for you to go and get the nails done and everything. With the paint, because I don't put the polish on it. We don't do that. But
you cut them and file them?
Well, I can trim it down some. I will cut them and trim it down some. To whatever level you want. And of course, if you have an ingrown nail, I'll address that as well. But we don't do the polish. We may rub a little lotion on and do that sometimes, but other than that, we don't do it. Yeah.
Okay, so let's go to the place where I'm feeling a little guilty here, and we're not showing my heels today. But tell us a little bit about, like, I kind of know, and I don't wear high heels all the time, but I do wear them sometimes. So tell us, we're in this together, about how damaging they are for our feet.
Well, I think, certainly, I'm not going to tell any ladies out there not to wear high heels.
Because they do look cute, right?
Yeah, I can't deny that. But I certainly would say that you need to be comfortable. You need to wear a comfortable heel. Not anything just really high, because then it leads to different problems with ankles and ankle injuries and that too. So if they're really high and you sort of twist your foot, then you're going to have a really bad problem with an ankle injury.
And what about these shoes now? I do not have not even one pair of them with these long points at the end. How do women fit their toes? Please make sure you contact me to let me know, because I want to know how you get your toes in those shoes.
Yeah, that's always been puzzling to me as well. But I would say, again, real narrow shoes, that's not good, because that could lead to furthering already an abnormality that you may already have. If you already have a hammer toe, that could make it worse. If you already have a bunion, that could make it worse. So basically, you want to have comfortable shoes, with a more rounded toe box.
Can the shoes actually cause those things?
Well, shoes certainly can make it worse, because basically, with the instance of a bunion or a hammer toe, basically there's a lot of heredity involved. That's hereditary. But certainly, if you're wearing shoes that are uncomfortable because you think they're cute or whatever, you're going to make it worse.
So now we know why we all walk around with our shoes in our hands, or they're underneath the pews when we're at church, and we're walking around with our flats. I know I always bring a pair of flat shoes. I walk into church with the heels on, then they go underneath the pew, and then the flat ones come out.
Well, that's usually how it happens. That's what I've been told anyway.
Yes. So what would you like to tell our viewers today, like some of the things that they could do to be able to promote healthy feet?
Well, I would say certainly during the course of the summer, which, at summertime is a good time to make sure that your feet are clean and dry, and make sure you're really monitoring the perspiration, because that could lead to a fungus developing, because it's just having all that excess moisture. And then in the winter as well, making sure that you are making sure that you're cleaning and drying your feet well. And there are socks, especially with diabetics, that can help to control the moisture and certainly help to keep your feet warm enough as well.
That leads me to another question too. I'm glad you said that, because I think about how many men wear sneakers without socks. I see it all the time, and that is so gross to me. I'm sorry guys, but when they take off the shoes, it's like, no, you keep your shoes on when you come to my house if you don't have socks on.
Yeah, I mean, really, you made a good point. You know a little bit about it without knowing it. But really, you should make sure that you're wearing nice, clean, dry socks. I know the temptation is there, certainly with sneakers, to just throw them on and don't have any socks on, but you really should take care of that as well. Make sure that you have some nice, clean, and dry socks on.
Well, you've got so much information today. I'm hoping that you're taking notes. Dr. Holley is going to show us some of his rooms where he examines the feet, and also some of the equipment that he has here to help you have great feet. Now we're standing inside of one of the examining rooms, and boy, does this look like fun. I'm about ready to make my appointment. This chair looks so comfortable, and you also have a whirlpool that you said I could soak my feet in for a few minutes?
Certainly can. We try to ensure that everyone has a nice, comfortable, and relaxing visit. So some people, they shy away from the whirlpool, but most people like it, and most people want to have it when they come in.
Yeah, I would imagine it would be like a foot, just like you said when you go for a pedicure, they always put your feet in something first to soften it up before they do their little stuff on it.
Yeah, it is very relaxing, and the people that say they don't want it, it's just because they've never had the opportunity to put their feet in, but everyone that does really likes it.
I'm going to ask you a question. Do you put a little disinfectant in there too? Because I wonder sometimes, I think you're very brave being a podiatrist.
No, we certainly do. We make sure that we put the little disinfectant in there to make sure, and it's completely sterilized between each patient. But we certainly do put a little disinfectant in as well while they're getting the whirlpool bath.
That's interesting. You have so many diagrams and things on the wall to help educate your patients as well. Tell us a little bit about this one that we're looking at with all the different positioning of the feet.
Well, yes. With the diagram, you'll have, we're showing you a lot about what a normal foot looks like, and then all the nerves in your feet, and then to let you know what an actual bunion looks like and the hammer toe looks like. And then the type of surgeries that we perform as well. If you, it shows you an example of what it looks like before and what it looks like after.
So what is like an extreme case where someone would have to have surgery? What's going on to indicate that?
Well, the largest indicator that I use is if they're actually having pain. You know, I try not to. Well, I don't generally perform surgery unless the patient tells me that they're really in a lot of pain. But then some people do come in for cosmetic reasons. They just don't like the way the toe looks. I mean, it doesn't hurt, but it's just they like to have it addressed because they know after coming into the office what their foot should look like. And they say, well, I don't want it to look like that. If it's not normal, then if it's abnormal, I like to have it look normal.
Because if it is abnormal, consequently, you may have pain or problems as you get older down the line.
You're down the line, certainly, as you get older, because I try to inform people of that as well. As they age, whatever deformity they presently have certainly can get worse.
Better to have the surgery when you're younger than older.
Yeah, I really do stress to do that. Although some people come in a little older and they decide, I've lived with this all this time, but now that I know and it's really hurting me, I would like to have it taken care of.
That's very helpful, very interesting. And tell us a little bit about these other diagrams as well, because they're actually showing us what our toenails should not look like.
Oh, well,
Yes.
well, yeah, we have different things in the office that, diagrams that you stated to ensure that what people will know, or the patients will know what a healthy nail looks like and what an abnormal nail looks like, and then how you can actually address it. So we definitely, and then I treat a lot of diabetics. A large portion of my practice is addressing concerns for diabetics, and certainly we're telling you the different types of things that go on with an actual diabetic foot.
Wow, that looks pretty serious.
Well, yeah, and I think that really when patients come in and they find out they're diabetic, and then they look at the diagram and find out what types of things can happen to their foot. If it hasn't happened already, then they're like, okay, I'll make sure whenever you say I need to be in, whenever you say I have to come in, I'll be here.
Wow. Well, there you have it, folks. You've seen the pictures. You got the information. I think it's time you call Dr. Holley and make an appointment real quick and take care of problems before they begin to happen. So, Dr. Holley, I'm seeing that you also treat ankle injuries as well.
Yes, as a podiatrist, we certainly address any ankle or foot problem, and that's medically and or surgically. So, and then we have the diagram here to indicate the different types of ankle problems and all the bones in your feet, so that people will know that there's a number of bones in your foot, and then what different types of ankle injuries that can occur. We have the diagram here to help explain those types of things.
That is so refreshing, because it's nice when you're going to a doctor that takes the time to show you the diagrams, that talks about what the injury is that you're experiencing, so that you can get a visual of it, because we know that visualizing and being proactive with our health and working with the doctor is the best way to get the maximum results.
It certainly is, and I certainly admire patients that will take care of their health and put forth the initiative to come and see the podiatrist. Because after they come in, they'll find out that it's good that they came in, and they'll get a very good education regarding their foot and ankle.
I know, I'm really ready. I think I'll make an appointment before we leave here. I'm probably at that age now where I have to pay more attention to my feet.
Well, at any age, at any age, patients should come in, or different persons should come in at any age to make sure that they're addressing their overall foot health.
And you were talking about this is one of 5 rooms that you have here in the medical center, or the wellness center, the main wellness center. And I'm looking also, you were talking about this ultrasound machine.
Well, yeah, the ultrasound machine, and we address any type of physical therapy that a patient may need. If they've sprained their ankle, certainly it'll be a way of addressing, relieving some of the pain there. Or if they have injured a certain portion of their foot, we use the ultrasound unit for that as well. It supplies a certain amount of heating element to whatever area of the foot that may be causing them problems or difficulties at the time. And then we also do whirlpool therapy in this room as well, and some casting, and as well if you broke your ankle, or if you broke a bone in your foot, we would do the casting in this room as well.
So then one of the big things that we try to do is to avoid the emergency rooms. We're all about, preventative medicine first, and then secondary, when you have to seek medical attention, we want to always be educating our viewers about the emergency room is for life and death emergencies. So then if somebody breaks their foot or their ankle, are they able to call you? Do you see people on an emergency basis, or only if your office hours are open during those times? Like, how would that happen?
No, a person can call at any given time. You can call our number 862-9957, and then it'll prompt you to whatever area, and there is a specific prompt regarding emergency. So if you're having an emergency, you hit that prompt, state very clearly what your emergency is, and then the phone call will be routed directly to me, and then I'll be able to call you right back.
And then in some cases you'll meet the patient here to cast the foot?
Yes, if the emergency is that severe, like a broken bone would be pretty severe, so we will bring them, come right in and make sure we can take care of it.
Well, I think about that. You don't have to sit, because a broken bone, they can sit you in the waiting room for 2 or 3 hours, because we know that that's on an emergency basis. So that's really great news.
Yeah, if they come in, and certainly I'll call the patient right back and ask a lot of questions to determine what may really be going on with their foot or ankle. And if I determine at that time you need to be addressed right then we'll make the time for you to come in.
Boy, isn't that exciting to know that we're right here on Main Street. This is a great Maine Wellness Center located right on Main Street near the 33, or the 33 and the 198, where it comes in together. And you can come here, you can get emergency care if it's a real emergency. You heard the doctor. I heard that clearly. He's going to ask you lots of questions to be sure it's an emergency. There's preventative medicine, there's education. There's nothing that you don't do here for complete wholeness and wellness around the foot and ankle.
Yeah, we want to keep you on your toes, is there?
Yeah, keep you on your toes. I love that. Thank you. No, folks, that's not my foot. But I am sitting in one of Dr. Holley's chairs, and this is very comfortable. I'm very much looking forward to my first appointment. So tell us a little bit about what you do with this pretend foot, right?
Well, actually, this is a skeleton model of your foot, and indicating you have 27 bones in your foot, and then basically this is identifying all of them. So then wherever the problem may be in your foot, I use this model to help educate the patients too, to let them know that, okay, this is your big toe here, and then this is where a bunion would be if the bone was sticking out on that side. So I use this to let people know where the bunion deformity would be, or wherever their foot may be ailing them. I'll show them with this model and where that would be. And if we had to do surgery, explain what type of adjustments we may have to do to their bones surgically. So I like to make sure I identify that.
That's pretty amazing. And as they say, a picture is worth 1,000 words, so a model must be worth about 2,000.
Yeah. Well, it certainly is. But a lot of people, they want to know, okay, where is this problem at? And it really brings a lot to light when you start explaining the surgery they have to have by showing them this model.
Well, again, Dr. Holley, I just thank you so much, because I've learned so much, and I know that you've learned so much today. So pick up your phone and call Dr. Holley and make an appointment today to take care of your feet so you can stay on your toes too. So thank you for tuning in once again, and remember, your health matters.